Hello, everyone. I am Dr. Brandi B. You know me. I am your triple board certified adult psychiatrist, child and adolescent psychiatrist, and pediatrician. I help worried and overwhelmed moms and dads who have children with different learning abilities and also other mental health disorders gain education and feel empowered over their children's mental illnesses so that their children can do three things: make better grades, behave better in school and at home, and also become the best persons that they can be. Again, you know me, but I'm coming to you with a little bit of a different purpose today. This will be the first of many of what I call Focus on It Fridays. And today's topic or interest is going to be to introduce myself as a medical mogul. A little bit about myself and my story. I was born and raised in Birmingham, Alabama. My mother was a nurse and my dad was a laborer. I went on to get my high school education in the Birmingham public school systems before I went to two small private schools. After graduating from high school, I got my bachelor's of science in neuroscience at Vanderbilt University, and then got my doctor of medicine at Meharry Medical College, both in Nashville, Tennessee. After finishing medical school, I went to Indiana University School of Medicine in Indianapolis, Indiana, and completed a triple board residency in pediatrics, adult psychiatry, and child and adolescent psychiatry. After completing that residency, I returned home to Birmingham in 2011, and since then have worked in a variety of clinical settings and have taken care of patients with a variety of backgrounds. So why medicine? From a very young age, I always knew I wanted to work with children. Initially, I thought that I would be a teacher, just as both my grandmothers were. I actually thought that until about 10th grade, when I got a chance to shadow my own pediatrician, Dr. Jacqueline Stewart, and became introduced to medicine and absolutely loved it. I had finally figured it out. I no longer wanted to be a teacher, but instead I wanted to be a pediatrician. And so I went off to med school. I was on my way to graduation. And what do you know? On one of those visits, when I came home to see my pediatrician, as I always did, just for encouragement, guidance, whatever I needed at the time, she said to me very calmly and casually, "I want you to consider a subspecialty." Well, I was confused, perplexed, and a little bit upset. It was because I had always wanted to be just like her, and she knew that. I told her. But in fact, what she wanted for me was not to be just like her, but in some ways and whenever possible to be even better. And so I enrolled in the triple board program after doing some research and saying, oh wow, I can do pediatrics and I can listen to people and help them with their problems, because that's what most people think psychiatrists do, tell people what to do. Well, I learned that that was far from what psychiatrists do, at least exclusively. But it also gave me a new goal, a new career goal, and the rest is history. Psychiatrist. Or is it? You see, at one of my graduations, a church member and close family friend said to me, "Brandi, you will be international and you will write books." And though I've traveled to a few places internationally, and I've given many speeches and spoken at several places, never have I written a book, and I certainly have not yet become international. But I never forgot those words. You see, Dr. Stewart was my first coach, although I have called her my mentor. The church members' words are something that I actually learned to have as affirmations and intentions. And I've kept those things in my heart until now. The time has now come that I have found a new coach, and I am now well on my way to becoming a medical mogul. Now, some may say, well, what makes you a medical mogul? And I'm glad that some are asking. In fact, there are several things. I'm knowledgeable in my field. I'm compassionate. I'm empathetic. I'm caring. I'm loving. Most importantly, though, I have a fierce desire to do what it is that needs to be done for my patients. And I do that on a regular basis. Just ask anyone who's come to my office. So now, what happens? What happens as I go to become a medical mogul? I will be studying, I will be presenting, and I will be writing. Yes, for those who know me, this will be in addition to the many other things that I do, like be a wife to an attorney, a mother to a 5-year-old, almost 4-year-old, and a 1-year-old, and have all of the several jobs, civic, social, and church obligations that I have. So what will that mean that I will need from you? I will need you to help me in 4 ways. You can pick all of them. First, I need you to follow me on all social media platforms. On Facebook, I am Dr. Brandi B, no space between the I and the B. On Instagram and on Twitter, I am Dr. Brandi_B. On LinkedIn, I am Dr. Brandi Bowling, MD. And on YouTube, I am Dr. Brandi B. The second thing that you can do is share and like this video. Let people know that Dr. Brandi is out there and she is coming to help you with all that concerns you. The third thing that you can do is to get ready for my new and upcoming businesses. I hope that when it is possible, you will support them. And at the very least, that you would tell others about my services and businesses if they find that they have a need for them. And lastly, I am asking you to support me in any way that you can, whether that be with your prayers or just a good, kind word, like even on this video. No good deed or positive vibe will go unnoticed and unappreciated. Well, for now, that is it. But you can be looking forward to hearing from me and seeing me more frequently in the upcoming future. I hope you have a great day, a safe day, and a happy weekend. Bye-bye.